Dr. Jennifer Bacani McKenney joins me now to discuss the impact of COVID-19 on rural hospitals. She's a health officer in Wilson County, Kansas. Doctor, rural areas were spared the worst at the beginning of the pandemic, but obviously that has changed. What are you seeing now?
Well, Omar, we are seeing a big spike in our rural communities right now. We know that COVID came to Kansas in early March, and we in Wilson County didn't see our first case until mid-April, and we didn't see our second case until the end of June. And then, now we are starting to see these bigger spikes. We know that through that time we thought, well, maybe it's going to spare us, maybe we're naturally isolated, and people kind of let down their guard. In the first 7 months, we saw about 60 cases, and now in the last couple of weeks, we're adding about 60 cases each week.
Healthcare options have been stripped away from rural areas over the last several decades. I know I've done stories and other correspondents with CBS News have done how a lot of rural hospitals have closed. You have more counties relying on one hospital. How has that hurt your ability to deal with these cases?
We do have limited resources in rural areas. For example, our county health department has 4 full-time employees, and they are the full-time contact tracers. They are working 24 hours a day, 7 days a week. We also know that our rural hospitals are closing in Kansas and in other states, and luckily our rural hospital is still open. We have 5 doctors in our community and 3 nurse practitioners. But if we do have one person that gets sick, that's a huge strain on the ability to take care of patients. We know that rural areas and urban areas are so interconnected because we need the help of larger hospitals when we have to transfer patients out, and we need to be able to take care of our own patients when they get sick.
So if somebody gets COVID in a big city as compared to in a rural area, it's still COVID. Hospitalization may be different. Tell me about what you're seeing when people come into these smaller hospitals with COVID.
Well, luckily, we are seeing mostly people with mild symptoms. They're able to stay home. We check in on them every couple of days. We call them personally and make sure they're doing okay. We treat them with over-the-counter medications, and we're able to keep them safely at home through their isolation period. But for some people, they do require hospital care. In our 25-bed hospital, which is a critical access hospital, we don't have any ICU beds. And so when those patients come in, we hope to be able to take care of them, and we do the best that we can. I know we do a great job. But then some of those patients then need to be transferred to higher levels of care. And for example, the other day we tried to transfer out a patient with COVID, and it took calling 11 different hospitals before we were able to find him a bed. And that's scary. When somebody can't breathe, when their families are nervous, when we're nervous, we really need to be able to get that patient to a higher level of care. And again, that's why our hospitals are so interconnected in the rural areas and the urban areas.
Dozens of health officials in your state have either left or lost their jobs after facing harassment from people who just don't want to follow the safety guidelines. You have received threatening messages. You have also been targeted on personal attacks on social media about a proposed mask mandate. What's behind this for health experts? You guys are just trying to do your job, really.
That's right. People are scared, and there's fear, there's misinformation, and we've been at this for a really long time. And so people are tired and they're frustrated. And so then you have healthcare workers like me and public health officials that are telling people to wear masks and social distance and stay home when you're sick. And that's not normal. And, that's not normal life. And people just want to live their normal life. And so when they hear us saying these things, they want to blame something, a reason why they can't go back to normal life, and we're the ones that are spreading that message, and so we're kind of the natural people to blame anyways. We really only have a handful of people that are kind of more extreme, that say that masks violate their rights, and we're just going to take away more rights after we start mandating masks. But really, the majority of the people in our town are so supportive. They're doing great things. They're handing out masks and hand sanitizer, and they just really want to help each other stay healthy and stay safe.
We just saw the video there of you speaking at the health department there, and you were wearing a mask. A lot of people behind you were not. Do you believe does race, ethnicity have anything to do in your mind in what you personally have experienced? You're a doctor, but if you don't look like a lot of other people, they may not believe you.
Right, right. I think we have to acknowledge the fact that race can play a part in this pandemic. We already know that patients' outcomes are affected. We see health disparities in their treatment and outcomes. And so I know that in our communities, like rural communities like mine, that race has been an issue in different cases, and in other communities, rural and urban. But I think that my experience is a little bit different because this is my hometown. I practice in the hospital where I was born. My dad, who is a Filipino immigrant, has been serving the community as a surgeon for the last 42 years. But that's just my experience. We know that we need to acknowledge race as a possible influence in the pandemic and just really within our lives. We need to have those conversations, and we just need to do better for people.
And despite all that, you're still trying to stay on as the health officer in your county. What's motivating you? I know you're from there, you're from the county, but how do you plan to deal with that hostility while also trying to treat the people who maybe don't want you in that position?
Well, Omar, this is my home. These are the people that I've known since I was a kid. These are the people I love and the people I care about. And our community is extremely strong. It's extremely resilient. And the people and the community are worth it. And so I'm not going anywhere. I will continue to do what I do every day because it's the right thing to do.
You're right. The community is worth it, especially if you're working there. Dr. Jennifer McKenney, thank you very much for your time.
Thank you.